Hi there. I'm going to talk about a topic today unrelated to theology or genetics, but may not be that common or uncommon for that matter. It's called non-tuberculous mycobacteria. You might say, what is this? Well, just to kind of give you a description, I probably have maybe 30 or 40 patients with same diagnosis, which is not a large, but certainly not uncommon. So I thought of talking about non-tuberculous mycobacteria. We all have heard the term TB, and it was pretty rampant 50 or 60 years ago. Then it kind of got low down. Then with the immigration, it started popping back again in this country. In fact, it was so bad in the past that people that had British rule used to be given a vaccine called BCG. That vaccine was never effective, but it was given, and it altered the skin testing for TB in many patients or many people who had received the BCG. And it also left a scar, usually on a shoulder. So those of us or those of you who are older and might have lived in Great Britain, India, Pakistan, Bangladesh, or some other countries where British rule was there, they might have received the BCG. So everybody knows about tuberculosis, but people don't know that the family name of the bacteria is Mycobacterium. That's like a family name. Mycobacterium is a family name. So since then, we know of several mycobacteria that have the same family name because they have common characteristics, but different treatment, different approach, different infectiousness, etc. So one of the common one is called MAC, M-A-C, Mycobacterium intracellulare. We recognize about this particular mycobacteria when we had much more HIV disease diagnosed and people were not treated, or we did not have effective treatment to improve the immunity of those people. And the MAC was a common infection at that time. This is called Mycobacterium intracellulare. And I'm going to talk about that for a short time today. If the time is insufficient, I'll probably continue that for the next video. So just to let you know that since there is a common family name, Mycobacterium, the bacteria, that is MAC, and the regular TB have common characteristics. This is also a very chronic disease. It also causes chronic cough. It can also cause low-grade fever. It can cause night sweats, lack of appetite, weight loss, coughing of the blood, and of course the chest X-ray would be consistent with something similar to TB. In regular TB or Mycobacterium TB, usually it affected the upper lobes, and sometimes there could be a scar or a cavity, which means small area where the central lucency would be seen on chest X-ray or CAT scan. The Mycobacterium avium can do similar stuff, but it also can present differently, including small nodules or small densities in the lung field. This particular Mycobacterium also grows into damaged lungs. So people that have damaged bronchial tube called bronchiectasis, this can grow. People who also have damage due to other causes, this bacterium can also grow. The symptoms, as I mentioned, are similar, but they're not present in everybody. And the chest X-ray abnormalities are minimal, but CAT scan definitely shows damaged bronchi, small nodules, or even upper lobe cavities. The common part about these two, or these mycobacteria is that these are chronic diseases. So the treatment required is long-term. So for example, the Mycobacterium avium or Mycobacterium intracellulare, both are same, interchangeably used, different names. That's why I used it. They usually need a triple 3-drug therapy for 12 to 18 months. Usually people say after the cultures have been negative, then you need for at least 6 months. Anyway, so I'm just going to summarize some of the things and the diagnosis of this disease. But before I do that, let's talk about infectiousness. So Mycobacterium TB can be contracted among family members or people who are in close contact with a patient who has Mycobacterium TB, or the TB which is infectious and contagious. Mycobacterium intracellulare does not transmit from one person to another person. Patients don't need to be isolated, nor a physician or a close contact need to be screened for the presence of this particular mycobacteria. So even though it belongs to the same family, Mycobacterium, it doesn't need isolation and it doesn't need family testing like it is needed in regular TB or Mycobacterium tuberculosis. Patients usually present with chronic persistent cough, sometimes low-grade fever, sometimes lack of appetite, weight loss, night sweats, sometimes coughing of the blood, and the chest X-ray might be abnormal, or CAT scan will show damaged bronchi or multiple tiny nodules or upper lobe cavities, scars, abnormalities, etc. The diagnosis is established by doing a sputum culture for TB, not bacteria. And unfortunately, the sputum culture for TB takes 6 weeks to get final. But since this mycobacterium grows rather quickly, we can know presence of this within 2 weeks, especially when we identify it and then DNA probe or PCR tests are done. And it will show specific type of mycobacteria. So essentially, we do get diagnosis in 2 to 3 weeks after the sputum culture is done, but it might take as much as 6 weeks. Since this is not contagious or infectious to others, we don't need to start treatment when we suspect it, but we need to have a confirmation, and many times preferring confirmation by 2 or 3 sputums. If somebody is unable to produce sputum, or there's a need to rule out other diseases, then we do an endoscopy of the lung called bronchoscopy. And again, we collect the same samples and send it for TB cultures, and once they come back positive, then we treat it. Just to add that sputum culture is positive for TB, but there is a newer blood test for Mycobacterium TB, not for MAC or Mycobacterium avium or Mycobacterium intracellulare. These are all same terms, 3 different names for the same organism. There is a test called quantiferon for TB. This quantiferon for TB is a blood test, and it checks particular type of an interferon. And that test is good for regular TB, which is infectious, contagious Mycobacterium tuberculosis, and not positive for MAC, which is also referred to as Mycobacterium avium, or also referred to as Mycobacterium intracellulare. I'm repeating this because a lot of time people will get confused about it and feel that somebody has TB and they need to be isolated. And these 3 names are interchangeably used for the same bug where you don't need isolation. The treatment is with triple therapy or 3 drugs and sometimes 4 and sometimes 5. This is a chronic undulating disease. Untreated, it will and continue to damage more lung tissue, and people may have other systemic symptoms that I mentioned, including severe weight loss. I'll talk about the treatment specificity and other stuff next time. Thank you for watching. If you like it, please subscribe. Thank you and have a nice day.